Hello, good morning everyone, and welcome to our 15th BC Poultry Symposium webinar. Thank you to everyone who has taken the time to join us this morning, and of course I want to thank all of our sponsors as well. Today we have our very own Dr. Gigi Lin presenting Understanding Poultry Plant Condemnations, Prevention and Control. So Dr. Gigi Lin received her Bachelor of Science in Agriculture from the University of British Columbia and earned her Doctor of Veterinary Medicine degree from the University of Saskatchewan. Gigi joined Canadian Poultry Consultants in 2017, where she provides diagnostic, research, and field services to the poultry industry in Western Canada. She particularly enjoys disease investigation and client education. In addition to the commercial industry, Gigi is passionate in providing services for small flock, pigeon, and game bird owners. Gigi has been an active member of International Toastmasters since 2012. She has been a volunteer veterinarian for the Langley Animal Protection Society since 2017. So this webinar is being recorded and will also be available to view at a later date on our website as well. We will likely have a few minutes left for questions at the end of the presentation, so please feel free to type them into the chat box as we go along, and we will do our best to get to them, time permitting. So with that, I would like to turn it over to Dr. Gigi Lin.
Thank you very much, Lindsay. Can you see my screen well?
Yes, we can see.
Perfect. Thank you. So good morning, everyone. As Lindsay mentioned, I'm going to talk more about the condemnations that we see at the poultry plants. And for those of you who are mainly, taking care of boilers like turkeys, you guys are probably very familiar with this list that you get at the end of the flock cycle. Once the birds are shipped, the processor will send you back like how well did the bird do, like how many condemns, like what the condemnations really is. It's a record of all the pathological changes, all the gross lesions that we see in broiler carcasses, and that leads to, unfortunately, that leads to condemns, like carcasses that either being trimmed or has to be disposed like completely because of various different issues. I'm going to focus on a couple of the most common ones that we see in our day-to-day practice, especially in broilers. The first one is cellulitis. This is probably the most common one, not only in Canada, but also across like the world, especially found in broilers. I find there are more cases associated with broilers, like with heavier weight in general, and we can explain like why it is. So what really cellulitis is, it's basically meaning the inflammation of connective tissue, particularly the skin, and so that's the dermal layer, and also the tissues that right underneath the skin. So that fat, like that's fascias in between the skin and also the muscle. And this is a picture of what a typical cellulitis looks like. I guess most of you guys, like especially growers or especially you guys who work on the field, rarely will see actual cellulitis like in a real time, because most of them are caught like in the processing plant. So in this picture here, I'll put out my laser pointer. We're looking at from the back end of this chicken here, and that's the vent where it has been eviscerated, all the guts have been taken out. And you see this really like cheesy looking, thick looking yellow, what we call like a really thick fibrin. This is the lesion that we're looking at, like caused by like inflammation with some secondary bacteria infection. Most oftentimes, especially in broilers, we find it in the lower abdomen. And this is really related to how the body of the broilers are, and when they get really heavy, they're sitting on the ground more, increasing the contact of this particular area around the vent and also in the lower abdomen with the litter, with the substrate. And we usually see it later in life, like especially when the birds like put on more weight, they have more fat, more muscle tissue in that particular area, increasing the contact. The most common question is what causes cellulitis, and it really comes back to the basic, where really cellulitis is caused by anything that can make surface scratch on the skin. So basically anything that damages the surface of the skins. What happens is once there's a cut flake, this is a picture of the breast muscle, and you see that really clear cut site right here. So once they get a cut, which is a damage of the physical barrier of the skin, then all the normal bacteria, the reason why I put normal is it's most of the time when we see cellulitis, it's not caused by like a foreign bacteria or like a foreign viruses or a new virus. It's usually the bacteria that's normally that you can find like in the chicken feces or in a poultry barn that has an opportunity to gain entrance to the skin and then also the underneath layer, and eventually subsequently causes an inflammation and also infection underneath. So you'll see that cellulitis. Obviously, more severe cases would be there are more cuts associated, or there's more time allowing the reaction to form. Other cases also, when the birds has like a poor immune system, they have less likely of like an immune power to heal that particular lesion. So you see cellulitis more severe in these cases. Some of the time when you see cellulitis, the poultry plants, in the end, they will probably trim that particular area if they don't see any other lesions. But in the end of the day, it is definitely a significant economic loss as a whole. So what causes scratches on the skin in broilers? There's lots of different things that can do it. For example, birds huddling from any uncomfortable environmental conditions, especially when they're older, when they have run out of space, like contacting each other. What it does is when they're huddling, when they're piling together, they will increase the contact between each other and also on the floor, on the environment too, and increase physical injuries. This is an example. I hope the picture shows up well on your screen. I know it's a little bit darker. On the left here, you see these broiler chickens avoiding this particular area, and they're all kind of huddling and concentrating on the end and on the side wall of the barn. And this is what happened when we look under this right picture here on an infrared camera, and you'll see why the birds are avoiding. So this particular area, it's cold and also it's wet because there's some leaky like water, also some dams like environment here. So birds are avoiding this particular area. Any kind of temperature fluctuation can do that. Sometimes you'll see birds like huddling or favoring a particular part in the barn when there's uneven ventilation, like drafty area, for example. Other situation that I find it very common would be any kind of environmental changes that stress them out and causes what we call like a pile up conditions. Like the birds are not only huddling, but they're actually stepping on each other. And that's definitely obviously will cause a lot of scratch, like, and also physical damage as well. One of the most common thing that can happen in broiler farms or even turkeys, broiler breeders farm, you'll see once in a while, like if there's any equipment failure, for example, this is a farm that we went to, the trigger pen was not working, so all the pens near the trigger pens were empty. And this is what happened when some birds like experience a period of starvation, especially in broilers, because they really need to be like, they need to eat like all the time. So once feed are come back on, then obviously everyone will be going after that particular feed pens, and everyone will be crowding around feed pen and causing damage. That can happen even when it's during a short period of time, especially in broilers that has a really fast growing weight. Water outage is the same thing. Another pile up situation or another situation that can make the birds very stressful would be, I'm gonna take off my laser pointer, would be birds that piling up from other changes, like not loud noises. I have seen cases where there's rats like infestation in a barn, and the chickens like never seen the rats before and they get spooked out, that can happen. Any kind of like sudden human activity that the birds are not used to, like even as simple as you change the color of your shirt or your coverall one day and the birds see it as foreign and different, they can definitely spook out and lead to more howling and more excessive activity. Flickering lights, this is one that's often difficult to detect. And I'll show you an example, a really good example. This is a border breeder flock, not a border flock, but it still explains like how different like a flickering light can do to a particular flock. So I'll start both video. So on the left picture here, I'm going to start the right one. Hope you can see it well on your screen. The right side on your screen, it's normal condition where this is a normal flickering, normal light, like intensity under a normal situation. Where on the left side, you'll see this particular light bulb here that is flickering. And even though in most of the circumstances, like humans, like we're not able to detect it, but birds are actually way more sensitive to changes to light intensity compared to us. They can detect it and make them feel uncomfortable and also potentially increase like their activity. So fixing like flickering lights, like adjusting light intensity, minimize the sudden changes of light intensity can really help in some cases. This is an example that we did. I'm going to stop this. This is an example that we did using the iPhone slow motion. So I think it should work on an Android phone too. When you put on a slow motion, it's able to detect different light frequency way better than a normal camera and also from our naked eyes. Something to pay attention to if you're seeing cellulitis and you're not sure why you keep getting cellulitis from time to time. We sometimes see it in this situation, we sometimes see it in layer production too, especially when we see cases that there are more flighty birds and more birds like packing each other, doing this cannibalism activity. Well, light intensity is something that I always like recommend to rule out. Litter quality, this is one of the things that I highly recommend to rule out when you see cellulitis, and for obvious reason, because skin, especially in the lower abdomen in the birds, like they have really high contact in terms of time and surface area when the birds are sitting on the litter. So any kind of high moistures, it can create ammonia buildup, which ammonia itself it not only can cause like damage to the respiratory system on the birds, can also causes like conjunctivitis, corneal ulcer, like blindness in some severe cases. But ammonia can also cause like direct injury to the skin and also the food pads too, when they are in a very high concentration. And when there's moisture, when there's warmth, of course, that's a very favorable place for bacteria buildup, which again, increase the severity and also the risk of cellulitis. So more bacteria, more severe infection. Another point is coarse litter, like litter material that is sharp, that is that's very sharp or more prone to causing damage. I don't really see that very often, but once in a while there would be a case that we suspect like maybe the litter materials, it's a little bit sharp for the birds. So litter management, there's lots of different reasons why it causes like wet litter. So going back to the basic, I see that more in the winter time where the barn is underventilated, the more moisture build up. Wet droppings, sometimes wet litter can cause because the birds are just flushing, like voiding high water content from their feces. So enteric diseases like necrotic enteritis, cocci, doesn't have to be like a full-blown like cocci that causes mortality, a subclinical cocci that causes some watery feces can also cause like wet droppings and wet litters. Sometimes we see cases where in times where overuse of antibiotic, for example, or using products that has like a really high sodium content, or doing like different kind of like supplement and drinking water, feed outage, those factors can really changes the gut flora, the microbial system in the gut, and causes like wet dropping as well. Once in a while, I would see a case where you walk in the barn and it's all cleaned up and it's get ready to put in the new sawdust for the next placements. Sometimes there's not enough downtime for the barn to dry off completely, and for that reason, and you'll get very wet litter start from the get-go, and that doesn't really help anything in that condition. And water leakage, once in a while you see that. In this particular case, in the left picture here, you'll see a very clear evidence of water leaking from the water line causing damp litter. It's way easier to tell in a newly placed barn when the chicks are really young. However, when the birds are getting older, filling up all the spaces, sometimes a water leakage is really hard to detect. So I highly recommend everyone to really pay attention to the water line level, to all the nipple drinkers, and also the water consumption can often tell you a lot of information. If there's any water leakage, or even if there's any unusual high water consumption, usually you'll see wet droppings associated with that too. Looking at when you're picking up the mortalities, like sometimes it's obvious to see like kicky litter in this condition, but another evidence that can tell you when the wet litter, there's a wet litter condition would be the food pads. Like this is a case from a turkey farm that has really dirty fecal material and litter stuck to the food pads, and that tells me an indication that the barn condition's probably really wet. Wet litter doesn't only contribute to more severity of cellulitis and also more incidence of cellulitis, but oftentimes you'll see food pad lesions as well. So these are what we call Proto-Dermatitis, which is an infection, inflammation of the food pad, of the skin, and also the underlying tissue. In this, especially in conventional broiler, it usually doesn't cause like a direct condemnation to the whole bird. If the rest of the birds is doing perfectly, there's no other lesions like is seen in the bird's like carcass, but because like the legs are removed. But this can be a huge issue in some of the birds that they sell the bird as a whole, like with the head and with the feet like attached. Those are the specialty birds, for example, like silkies, for example, Taiwanese chicken, and that can definitely downgrade the carcass and sometimes like lead to a full body condemns. This is also a very huge welfare concern during welfare audit, that especially at the processing plant. This is one of the criteria that we look at and show that how to and demonstrate like the welfare of the birds like in the barn. And having too many birds that have excessive like food pad lesions can lead to an audit failure. And obviously the birds' welfare conditions are in concern. It's painful condition. It's also not comfortable. In summary, minimizing cellulitis, we discussed about a couple of things, like provide a comfortable environment, minimizing stress like in the environment, pay attention to the litter quality, and stocking density. This is often time that we see changes quite a bit from a barn that's placed with a higher stocking density versus lower stocking density, with more birds, more litter condition, more wetter litter condition, and also more contact like in between birds, more competition. The risk of cellulitis is definitely higher, and the management should be adjusted accordingly. Other than skin lesion, once in a while, I would say maybe a couple of times a year, we run into a problem where the plant will call and will tell us that, oh, there's muscle lesion. It's quite rare. It's not very often. One of this is this example here. This is, I'm just going to orientate you the photo a little bit. On the right, let's start with the right. This is the normal condition. And I cut open the external, that breast muscle, that pectoral muscle here. So I cut open the breast muscle. And once you cut open the breast muscle, you expose what we call the deep pectoral muscle, which normally we call it as the breast tender. That's the part, that really thin tender strip right here. So that's normal condition. When there are pathological lesions, we'll move on to the left pictures here. You'll see the tendons, like the deep pectoral tender here. It's very swollen. It turns like really pale white color. And sometimes you'll see in the left picture circle here, there's a lot of what we call edema, like accumulation of fluid. We see it most commonly in heavy fowls, like birds that are healthy, but we also see it in conventional broilers from time to time. For example, this case, this is an actual bird that was submitted from a plant, like 39 days old broilers. Again, I cut open all the breast muscles and you'll see this greenish color, which is an indication of dead necrosis, like necrotic tissue. Oftentimes you'll see it along with other lesions, like particularly on the wings. You'll see some bruises. Again, another name for this disease is it's green muscles disease, because like the tissue that's turned green color, an indication of necrosis. Sometimes you'll see like birds with bruisings, like fracture. And this is a case that we later found out that's likely associated with some sudden rodent activity. So how does deep pectoral myopathy, which is what we call the green muscle disease, started? First of all, you gotta have to understand what the breast tender and also that particular deep pectoral muscle, it's a muscle that is very, very important for flight. So for wing movements, with normal wing movement, that muscle has to expand and also move like to trigger that normal wing movement, which means more wing movements, you're using that particular muscle more often. And what deep muscle myopathy is really the necrosis and atrophy of that breast tenders. And usually how it started is wherever there's sudden stress, the stress that we pretty much talk about along with cellulitis, when the birds have increased bird activity, they will flap their wings more excessively. So when they flap the wing more excessively, they require more blood. So there's more blood going in that particular area, and the muscle eventually kind of gets, the muscle actually swell up really big until to a point there's no more space that the muscle can swell anymore. Then to a point it will impair the blood supply and decrease oxygen supply to that particular muscle and causes muscle necrosis eventually. It usually doesn't happen just with a couple minutes of flapping. It's something that's more chronic than that's going on. And again, it really depends on the size of the birds and how often they're flapping, and the duration can play a role too. So prevention, it's really anything that we talk about from preventing cellulitis, trying to make the birds as calm as possible, avoiding loud noises. Once in a while, we see a case where there's constructions next door, or growers are moving lawnmowers more often along one side of the barn, and you see more birds die from deep pectoral myopathy associated with that particular site. The second condition I'm going to talk about is liver, which is another very common condemnations that we see in Canada and also worldwide. Usually it is evidence that tells you the bird has some systemic disease going on, like sepsis, like bacterial septicemia, or viral infections. Those are some possibility where we see some liver conditions. And according to the Agriculture and Agri-Food Canada guidelines, hepatitis liver conditions, usually in most of the cases, the entire chicken carcass is condemned because of the risk of sepsis. You'll see the word hepatitis coming back a lot. Hepatic is really the Greek word for liver, and titis is an inflammation. So hepatitis altogether is the inflammation of liver tissue. And there's, as I mentioned, there are so many different causes. There can be infections. We see it in viral disease, for example, inclusion body hepatitis, IBH. We see it in bacterial infection. Parasite, it's another, I would say, less common that we see in broiler chickens, but we see it more like a parasitic migration in the liver, for example, in other long-lived birds. Blackhead disease is another one that if you're from the turkey industry, you're more familiar with that. They do cause a severe lesion in the liver in systemic cases. One of the most common questions that I get from a client is, oh, I get liver condition, I have a high condemnations rate, there's majority of them are liver conditions. Why do I have liver condition? My first question is, you gotta have to figure out what kind of liver condition, and you can't tell unless you have the liver, unless you have the tissue on the table for a pathologist or for a veterinarian to examine, because there are so many different kind of liver conditions, so many different conditions that can lead to a liver lesions. So it's so important to exactly find out what they are, because each of them has different pathogenesis, there's different causes, therefore the control and preventions can be very different. I'm just going to pick a couple most common ones that we see. For example, bacterial hepatitis is the most common one, and I'm going to talk about ascites, pulmonary congestions cases, and IBH like in a bit. So I'm going to start with the most common condition, which is bacterial hepatitis. I would see over 90% of the, maybe 95, as high as 95% of the liver tissues that submitted to our practice, they are cases of bacterial hepatitis. And this is a research that was done in 2015. And what they did was they collected a whole bunch of samples, liver samples condemned from the processing plant, and they did an aerobic culture to find out what bacteria is involved. And you see, E. coli, Streptococcus, Staph, Enterococcus, Clostridium, that's the bacteria that causes necrotic enteritis. And you'll notice, like, these are, again, nothing foreign. Like, it's not anything that's exotic to the poultry barn. It's something that we usually normally see in the feces, like of the birds, for example, on the skin, like for example, in the Staphylococcus species. These are normal, what we call like opportunistic bacteria in the wrong place, which is a liver causing hepatitis. Why liver? Like, I always that's a question that we always wonder, why is always liver? Why we don't see it in other organs? Like, what about the spleen? What about the kidney, like heart? And first of all, one of the reasons is liver is a really big organ, and when it has like a lesion, it's very obvious. Like, let's look at this picture on the left here, where you can see once we open the bird into their coelomic cavity, that's the liver right there. So very easy for the inspector, for anyone at the plants, like for even like farm managers to detect like there's something wrong like with the liver. Liver is an organ that we see a lot of like bacterial infections presenting. One of the biggest reason is liver. One of the function with liver is it's a really important organ to filter the blood system. So we think of it as your water filter. It's screening all the harmful materials. So this includes all the virus, all the bacteria, and all the bloodstream from the bloodstream. So they every day, like every moment, you're not only the chicken liver, but our livers are exposed to different kind of harmful material and doing its regular function to screen it. And especially all the blood, like from the stomach and also from the intestines, eventually they are all going into the liver for screening. So it is a very important organ. It's more like a security system to make sure that the rest of the blood that going into the heart, going to the rest of the organs are normal and contain as minimal harmful substance as possible. So hepatitis, the inflammation of the liver can occur in two different scenarios, or it can combine like together. First of all, when the hepatic system, the liver, is overloaded with harmful materials. So too much toxin, bacteria, viruses presenting to the liver that beyond the functional capacity of the liver. So that can happen, causes damage to the liver. Or in cases where the immune function of the liver is compromised, so they're failed to work at full capacity. And then when that happens, there are two things that can occur consequently. One would be localized infection, so which means that the hepatitis, the damage, the infection is only localized to the liver. So in those cases, you don't see any other lesions in the bird, but particularly in the liver. And in these cases, it has a way better chance to heal because whichever that toxin, that inflammatory substances are not getting into the rest of the birds, but only confined in the liver. However, when you go beyond that, when the harmful substances are entering the rest of the circulatory system, like through the heart, like to the kidney, the brain, to other organs, it will turn into a condition. The worst case scenario would be sepsis. When do we have cases that when the liver are overloaded with harmful material? The most common cause would be, remember I talked about in the beginning when I talk about liver condition, all the blood from the stomach and also from the intestines are going to the liver. So when you have a lot of gut damage that allows bacteria, allow toxin and virus entering that bloodstream and going to the liver, that greatly increases the chance of hepatitis. So this condition, for example, would be coccidiosis, nicotic enteritis. Sometimes we see the bacteria that causes nicotic enteritis I found in the liver, that's the Clostridium. So that's more likely related to a nicotic enteritis cases. Dysbacteriosis, which is imbalance of mycobacteria. Overheating is another common findings where when the birds are overheated, their gut lining are more likely to get damaged and get leaky, and allowing more substances go into the bloodstream. And in rare cases like contaminated water can also do that, especially in birds that are, you know, longer lived birds. That's another way to present a lot of bacteria and lots of like pathogens to the gut system and eventually entering to the liver. And in another case, like when the immune function of the liver is compromised, like so there's immunosuppressions that are caused by either environmental factors or viruses. Particularly, I'm going to talk about one virus that is very, very common in the Fraser Valley. If you guys have worked with us, like this is a virus that you're probably very familiar with at this point, especially in the broiler industry. It's infectious bursal disease, short for IBD. In the bursa, it's a very unique organ that is found at the very, very end of the intestinal tract. It's right like next to and adjacent to the vent here. This little organs, like very tiny plumps, like really tiny nodule here. It's the bursa. And the function, it's very important to generate immune cells for the chickens, especially when they're at a very young age. So when you have a virus that is the infectious bursal disease virus that damaged the bursa especially at a very young age, it just impairs the whole immune system of the bird. It's almost, I always use, like someone told me about this analogy of HIV virus, like AIDS in humans. When you will never, from the outside, you will never see a person that, oh, like you can tell this person has AIDS, like without any, because it usually doesn't show any particular symptoms. But what AIDS, like HIV virus does is it's impair the immune system of that particular person and make him or her like way susceptible to other secondary diseases, make the person weaker. This is what exactly IBV does to a chicken. So I usually refer it to a silent killer, especially the strains that we are seeing in North America. Most of the time they don't cause like a direct lesions. And when you have infectious bursal disease virus, and other viruses, bacteria, or even without other virus, bacteria, but just environmental stressors, you're making the birds way more susceptible to these conditions, like decreased flock performance, secondary infection. I often see cases presented very differently, like a bacterial infection, E. coli, for example, to a range of different viral presentation, for example, inclusion body hepatitis, IBH, and also increases the severity and clinical impact of a particular diseases. And oftentimes you'll see more condemnations, not only liver conditions, but also like cellulitis, like respiratory diseases. So this is one of the most important virus, particularly in broiler industry in the Fraser Valley here, when we're so close like to each other, a very poultry dense environment. And the reason why is this particular virus is very widespread. You can find it everywhere where there's chicken. And the unfortunate part is it is really highly resistant to environmental conditions and disinfectants. So you can do your C&D. I still recommend you do that. It can help to decrease the viral load, but it's really difficult to completely eliminate it, especially in a conventional setting where you're placing birds like 2 weeks after 2 weeks. The control really relies on a really robust dynamic vaccine program that involving all the levels. So definitely talk to your veterinarian about that if you're suspecting IBD virus. Those would be the cases where you see unexplained recurrent high condemnations, unexplained recurrent high mortality due to like random like bacterial diseases or viral diseases cycle after a cycle. That's a time that maybe we can take some blood and also do some PCR screening to look for bursal disease. One of the most common challenge that we see, particularly in broilers. Second liver condition, it's sometimes we call this what we call it's chronic passive congestion. So this is a picture that represented really well. The liver is very congested. You'll see some like swelling. Sometimes you'll see some patchiness of congestions in the liver. And we see that a lot associated with a particular syndrome known as ascites or pulmonary hypertension cases. So another name for it is water belly, which is very self-explanatory. Sometimes you'll see the birds that flip over, but the abdomen is very distended. And when you cut the abdomen open, cut into the abdomen, you'll see a lot of fluid. Like these fluids are often just either like cloudy, have a yellow tinge of color in it, and most often time the liver, it's very, very congested. So we call this a passive chronic congestions liver, and that has that are associated mostly with ascites and water belly. This is a condition that it's very commonly found in broiler. For one reason, they're really high productions, has high productivity, high growth like animal, so very, very susceptible to conditions like ascites. Another very common findings that we see that is ascites are associated with exposure to cold stress or exposure to condition that provided lack of oxygen to the bird. And this is usually how it works like in the body. So when a bird is exposed to conditions where either cold temperature or in high altitude that has lack of oxygen, the birds will, let's say in this case, like cold temperatures, like very low temperature, chilling, for example. And when that happens, the birds needs more oxygen to supply warmth, like to more oxygen to supply to the blood, like to their body to keep them warm and keep their body function. And when you need more oxygen in the blood, another things that you really need is the blood cells. So red blood cells to carry more oxygen. So when you have red blood cells, this picture explain it really well that the more red blood cells in that confined space, it's like a pipe, right? Your blood vessels, then it's getting more crowded. There's way higher density. So therefore it increases like more heart pressure. And when this cycle keep going like for a long extended period, the heart muscles are working way harder to try to pump that thicker blood through the whole body of the chickens. So eventually the heart failure will happen because of hypertension, high blood pressure, and then causes vascular damage in the other organs. And the one that's like immediately after right after the where the blood goes to, it's the liver. So all the bloods are backing up and eventually causes like hepatic liver damage. So water belly, that's a conditions that can be minimized with good ventilations, minimizing the birds with cold stress, even when the birds are at a very young age, like in their first week, even when they're exposed to a prolonged period of cold or lack of oxygen, poor ventilation, it can significantly increase the risk of ascites like down the next couple of weeks, like in that cycle. Another condition would be, I'm sure lots of people are familiar with this inclusion body hepatitis, IBH. Right? This is a classic example of how the liver look with IBH, like some what we call like pinpoint hemorrhage, like petechiations. I would say I rarely see condemned liver showing as inclusion body hepatitis. It's very uncommon to see at the processing plant. The reason being is most of the birds that are infected in conventional broilers, they're between 20 to 30 days. So birds infected usually die on the farm. They usually don't make it all the way to the processing plant. However, once in a while, you'll see a case of later presentation of IBH where birds get infected at a later age, like past 30 days, like 35 days. Then in those scenarios, you'll definitely see some more liver conditions associated with inclusion body hepatitis. So I'm not going to go into more about inclusion body hepatitis. If you want to know more, we actually did a full 1 hour presentation of IBH. If you go back to our BC Symposium video library, you can go back to that inclusion body hepatitis, and it will has another story about IBH for you. Last one, which I'm not going to go into the detail because it's very rare. I actually haven't seen it in the last 5 years of my career, would be things like Myopathy disease, like tumor, for example, tumor lesions in the liver. We rarely see that, and it's most likely I have to give credit to how widely we use Myopathy vaccines in the commercial industry. That has greatly reduced the cases of Myopathy disease lesions, Myopathy-related lesions in the processing plant. So we talk about cellulitis, we talk about liver, and another most common thing next on the list would be respiratory conditions. So anything from Air Sac infection, which is most commonly seen, or pneumonia. Sometimes we have cases where complain about tracheitis, like bronchitis, for example, associated with ILT, fungal infections, something very rare, but once in a while, like you'll see that in the processing plant too, due to various reasons. Before I go into more of the different respiratory conditions, it's very important to understand that the bird's respiratory system is very, very unique. They're so different from the humans. Like on the right, that's us. Like we have big, huge lungs like in our body, and also work with the circulatory, the blood system for gaseous exchange, taking out our carbon dioxide, bringing in the oxygen. In birds, it's very different. Like us, they have like 2 lobe lungs as well, but instead relying on the circulatory system, they also, in addition, rely on what it's called air sacs. So these are balloons. There are nine different balloons like throughout their body to facilitate gaseous exchange. This is a really important evolutionary adaptation because with the air sac, it's actually make the birds like way lighter, and which favor them for flying. So it's an important evolutionary adaptation. And it's great because it has a really large surface area for gaseous exchange. However, it comes with a limitation disadvantage would be when there's a really large surface area for gaseous exchange, this means that there's a really large surface area for pathogens to enter when this surface layer is damaged. So you see all the air sacs like, associated with different body parts of the chickens, and that's increased the likelihood of causing inflammation and infection when the air sacs are infected. And I generally see more respiratory diseases in fall or winter because, as we all know, these are conditions that there are lower ambient temperature, especially for those of you who are in BC this last winter here. It's get into a very chronically cold condition. We have seen a lot of respiratory diseases in general across all commodities. It's getting more difficult to control your ventilation, to keep the barns like heat up. So subsequently, there's more gaseous like buildup, for example, your carbon dioxide, carbon monoxide, ammonia, more it can also be associated with like dusty condition. All of these can cause this like more severe damage to the respiratory systems. And I have a case to look at. This is what I call boiler farm A. So they're conventional boilers, flock size 10,000 birds per floor, and over 5% of condemnations, particularly in the top floor. So some high mortality, some poor uniformity, and the birds were quite underweight. Bottom floor was doing much better with on-target performance. And this is what the mortality level looks like from this particular farm. So they started off like the regular normal mortality and then dropping here very normally, but unfortunately they have like increased like mortality towards the end of the cycle. So we got some birds at the end from the processing plants, like in addition to complaints with air cellulitis, like respiratory lesions. We also see the poor uniformities, like these body weights were ranging from 1,600 to 2,100 grams, a huge range of body weight, severe fibrinous air cellulitis, and also pulmonary congestion, so lung congestions. And this is a picture. So normal air sac, this is what it looks like. The analogy that I use is it's just pretty much looks like a layer of like cling wrap. It's transparent, it's very thin. So these little arrows, I hope you can see well, like from your end. So you barely see the air sac. Like this is a normal condition. You can see these are the kidneys. You can see the kidneys like really well underneath in a normal condition, healthy air sac. When the birds get air cellulitis, what happened is it's really similar to cellulitis, like the same like the same pathogenesis like behind it would be it has like inflammation, bacteria, and the body's trying to fight it off with their immune cells and causes this really thickened layer of air sac. So see how cloudy it is, it's yellow, and when you see from this angle, you can't see through the guts like from going on top from this angle. So this is a severe case of air cellulitis. So we did some tests, submitted some lung tissues and also some air sacs to the lab to look under the microscope. We also did a PCR test for bronchitis virus, which we're going to go into next. PCR was positive, and we also see some secondary bacteria infection of E. coli isolated from the lung and heart tissue. And the diagnosis is infectious bronchitis and some secondary septicemia. IBV, infectious bronchitis virus, it's another very common virus that I see particularly in boilers, especially during the winter time. It is a gamma coronavirus, so it's related to the COVID-19, the human coronavirus that we see, but it's a particular genus that it's only causes infection in birds and avian species. So there's no, don't worry about like human transmission. There's no risk like to humans as far as we know like to date. It is a bacteria, it is a virus that just behave like COVID-19, very contagious, spread very quickly, and it can mutate like very quickly to different variants. So different variants, depending on what geographical area you are in, and also like depending on what the new disease like trends, like what the variants that exist in that particular area, you'll see different diseases. For example, like respiratory damage, like that's the most common one that we see in the Fraser Valley. Renal damage, reproductive system. This is a disease that we see it what we call a false layer syndrome in the layer industry, particularly in the eastern part of Canada in the last couple of years, that causes mortality, but also egg drop in productions. I'm going to focus more on the boilers, especially our boiler in the local area here. Most of the time when there's a bronchitis challenge, sometimes it's very vague. It's almost like the Bursal disease that we talk about. We don't see any specific like clinical signs. Sometimes we see poor uniformity, poor weight gains, higher condemns, particularly respiratory lesions, and it can also cause some immunosuppressions, like some secondary infection. Most likely in the winter time, or in cases where the barns, like the birds were exposed to cold temperature in the barn, we'll see it manifest as a respiratory disease. So conjunctivitis, watery eyes, sometimes we'll see, spelling here is to be snickering, oftentimes it's very mild, and I mentioned we'll see more Air Sac cases. And making the accurate diagnosis sometimes can be very tricky. Whether a case is bronchitis, really associated with bronchitis or not, is very tricky in boilers. The reason being is majority, I would say over 95% of the boilers, like as far as my understanding, they are vaccinated with bronchitis vaccine at the hatchery or on the field. So sometimes when you do a PCR test, like that's mean the test that pick up the genetic material of the virus, it will show up positive, but it's not necessarily meaning that it has a few positive. It can just simply meaning that the test is picking up the vaccine, so induced by a vaccine at the hatchery on farm. So finding a PCR test doesn't always mean that the birds does have a bronchitis challenge. We often have to pair with the clinical signs, with the histo findings. That's the finding of the lesion that are in the lung, in the air sac under the microscope. And also another very useful tool would be serology. So taking some blood samples, the closer it is to the processing, the better. So this is the blood titers from this particular flock here, taking it 35 days with the blood sample submitted from the plants along with the carcass. You'll see some high titers here. So management of bronchitis is really no different than other diseases. We look at the whole site, that's a chick trying to provide like as good as an immune system as possible and maintaining a low bronchitis like virus level, and also keeping them in a comfortable environment to minimize that active infection. So chicks obviously start with a strong immune system. And again, it goes back to any other diseases, like going back to chick quality, vaccine program, feed, and genetics. And viruses, to maintain at a low level, again, proper biosecurity is very important. Mites, darkling beetles, like pets, other wildlife on the farm, they can actually be mechanical vectors for a lot of viruses. So keeping their number low would be very important. And then particularly in bronchitis like virus, we want to provide the more favorable conditions for the chicks, and also very favorable conditions like for the virus. So with the bronchitis and also other general respiratory symptoms, we decrease the risk by minimizing them to exposure to cold or extreme fluctuating temperature. So because when they're exposed to coldness, they will require more energy and resources, so that will weaken their immune system, making them have a poor conversion and also poor performance, and make them more susceptible to diseases. And with any kind of respiratory symptoms, as I mentioned, it can be prevented from managing a good air quality. So going back to the litter, going back to the ventilation, and also the dust level in the barn, especially in some of the birds we see in Taiwanese chickens, specialty chickens that longer live, and also usually the barn condition is more dry. There's more dust level and making them more susceptible to secondary respiratory infection. And again, everything with, ascites, respiratory symptoms, everything starts before the chick placement to minimize their exposure to any kind of coldness. So pre-warm the barns, pre-warm the water line, having the chick boxes like away from the doorway so they're less exposed to windy, drafting environment would be very helpful. And don't forget about all the, what I call it, invisible stressors. So these are the stressors that it's really hard to tell. For example, like this is a picture that's taken under an infrared camera. You see on my naked eyes, I cannot see any difference on that particular wall. But once you have this infrared camera and you take a picture from it, you'll see this condensation, like purple. The more purple it is, like the colder is that particular environment. So some poor damage in installation and structure. So making use of sensors, data loggers, like with the technologies that are available, would be very, very useful, especially when you have recurrent problem with high condemns or unexplained like poor performance and mortality. Like issue, this is probably the last thing I'm going to talk about. My main message was, when you're finding condemnations with lake issue, or even lake issue when you're identifying on farm, it's very, very important to submit the samples and make an accurate diagnosis. The reason being is there are so many reasons, so many causes that can cause lake problem, like anything from the most common thing that we see, a bacterial infections, like pus, like in the joint, in their long bone, in their vertebra, and, you know, those kinky back condition, to conditions like, for example, like reovirus, like Myopathy disease, nutritional development conditions, and even like physical trauma from bird handling or equipment failure. So there's lots of different reasons. If we don't make an accurate diagnosis, like we don't know like what exactly the lake issue is. It's not always caused by a real virus or trauma. You have to find out by submitting the samples. And I'm gonna end with this interesting case. I only seen it maybe a couple times throughout the last couple years, which is what we call like a hardware disease. Like this particular picture is from the processing plant, and in this boiler flock of chicken, they were finding a lot of like metals, like rocks, like nails, like constructions material from the intestine and the gut, like the stomach of the bird. I see that once a while too when I do a necropsy. There's a piece of plastic, a piece of wire causing an abscess like in the stomach. Usually doesn't cause a huge problem, but once in a while you'll see like there's quite a bit of material that that can lead to like birds being held off, like lead to condemnation. So most of the time it's constructions, like fixing and repairing things that are being dropped like onto the barn, and birds are just very attracted to shiny objects, and they will swallow it. They can't tell the difference like between a feed and a shiny object, I guess, and it will cause like individual birds damage. Something to keep an eye on it, especially if you have some recent repair and fixing in the barn or even in the feed bin as well. So when you have high condemnation rates, in summary, always like collect tissue, work with the plants, communicate with the plants. Most of the plants do work with their veterinarians, and when they detected a very high condemnation level, or when you are anticipating a high condemnation level because of the farm history, make sure to get some tissue to make an accurate diagnosis. Collecting some blood samples always help to rule out underlying viral challenges. And then also going back to review your on-farm record, trying to find out your environmental data to help rule out if there's any underlying stressors. So pretty much like how you can do better in the next cycle and minimize the condemnation lost. And here's a list of reference. And thank you very much. And I am open to questions.
Okay, thanks so much, Gigi. Lots of really good practical information. We do have a few questions here. Two of them are very similar, asking about lighting programs with respect to cellulitis. So the one question here is, if 4 hours is better for cellulitis, how does one balance that when newer research is showing more darkness is better for bird welfare?
That's a really good question. There are lots of like available research. There's a lot of like new researchers available telling you what time and like how long the duration, how long the dark period, when the light, how long is the light duration during a particular age, like for example in aborters. I would say those are really good information. So take them as a reference, but also focus on what works for you. And the bottom line is any kind of like light adjustment or light intensity adjustment, it should be as gradual as possible. So having what I mentioned, like a dimmer light operation, rather than just like switch light on and off light, that would be very helpful in most of the condition, especially when you have a flock that is more stressful. Yeah, so going back, like, also minimizing like the flickering lights, like conditions. Sometimes it's not only associated with the duration of darkness or duration of light, it's how you adjust in between that dark and light period. And also if there's any flickering or any like sudden changes in that light program, light intensity system. If I answered that question. Lindsay, you have anything to add?
Yeah, no, I think that makes a lot of sense. And I think keeping in mind too, that even with these lighting programs, it's not necessarily one thing that's going to cause cellulitis. So, if you do extend that dark period, that doesn't mean that, okay, now because it's not that 4 hours that you are going to have cellulitis. These things don't happen independently. So usually it's quite multifactorial. So there's other issues going on at the same time, whether that's issues with wet litter or other environmental conditions, underlying diseases. So it's usually not one isolated reason where we see these big problems.
Yeah, exactly. Like going back, thanks for pointing that out, Lindsay. So go back to, have a checklist that would be very helpful. All the things that I talk about, like noises, like light intensity changes, like temperature, draft, feed, water history, have a checklist and go through the list if you find a lot of cellulitis cases, and that would be very helpful to try to pinpoint, say, what areas that need to be adjusted.
Great. Well, thank you, Gigi. We are out of time now. I want to thank you again, Dr. Lin, for sharing your knowledge today. And of course, thank you to all of our sponsors as well.